Good morning, and welcome to our continuing series on homeopathy with our beloved Dr. Pachegaonkar. Today, we're going to take up the subject of liver cirrhosis. But before we do that, I would like to suggest that if you have questions, you could email them to me. My email is very simple, Narada, Narada 12 at gmail.com, and I will forward them to Dr. Pachegaonkar. Liver cirrhosis, big problem.
Yes.
Especially for drinkers, I guess.
Alcohol. Yeah.
Please tell us about it.
See, it's a degenerative change in the liver. The worst part of liver cirrhosis is liver is very efficient organ in our body. So even if like 10 to 15% liver is functioning well, you don't get symptoms.
I see.
So in liver cirrhosis, if the liver tissues are getting degenerated, necrosed, immediately person doesn't come to know. No indicators are there. And once the indicators of liver cirrhosis are apparent, that means the liver is already 80% damaged. This is the worst part of it. The commonest presentation with liver cirrhosis is what we call varicose veins in the esophagus. That again can't be seen. Then varicose veins in the rectum, rectal veins, and varicose veins in the abdominal wall. So all these three locations are not apparent.
Yes.
And because these are locations where the portal circulation and systemic venous circulation gets shunted together. And therefore these three locations get varicosity. So we have seen some cases of liver cirrhosis, they are just silent, and once the person develops a hematasis, severe bleeding and vomiting of blood, or sometimes without any apparent reason, person starts bleeding from the piles, hemorrhoidal veins. So these are like common, and some people, so they develop protein deficiency and develop ascites, fluid accumulated, and then we come to know that the person is having liver cirrhosis. In liver cirrhosis, homeopathy has wonderful remedies to reverse it. We have seen wonderful cases. The commonest cause of liver cirrhosis in India, where we come across liver cirrhosis cases, is alcoholism. Alcoholism is commonest cause, though there are cases where without even alcoholism, the person develops liver cirrhosis. It can be secondary to hepatitis B, or it can be secondary to other hepatitis E. So all these liver cirrhosis cases, initially there is a hardening of liver, enlargement of liver. In very few cases you get jaundice. You don't even get jaundice in each of liver cirrhosis cases. The liver just fails. And once it becomes apparent, that means already it is 80% damaged. So homeopathy, on the basis of totality, we give the remedies, and the remaining liver tissue starts functioning properly and starts regenerating. We don't say that liver cirrhosis reverses, but whatever liver tissue is functioning well, that regenerates efficiently, and we have seen the person functions normally with whatever extent of liver is healthy, and we have seen person is clinically completely reversed from liver cirrhosis phenomena because he doesn't get that problem. Especially we have seen some cases where as an infant gets liver cirrhosis, even in children. And we have seen some cases where earlier though they used to feel that once liver cirrhosis means child is gone.
Yes.
But we have seen that homeopathic remedies based on constitutional therapy We calculate the miasm based on parents' history as well as the child's history, and we give remedies, and it has completely reversed, and for whole life the person has not developed liver cirrhosis at all.
How did it come about in a child?
That's a difficult. It can be a autoimmune phenomena. It can be an autoimmune phenomena. That is the commonest cause, what we call idiopathic. Where there is no apparent cause, we consider it as an autoimmune phenomena.
I see.
But there are cases where what we call a toxic poisoning, like plumbism. Earlier, the people who were working with a black ink in printing press, manually working and in contact with black ink, they used to develop this plumbism and liver cirrhosis as secondary to that. And I have treated cases where it was toxic because of plumbism, and we have a wonderful remedy called causticum, which is a wonderful remedy for reversing this, and we have done it.
One thing alone, one remedy alone, or others combined?
What we always give constitutional remedy based on constitution, but what we call this is based on the causation. Cause we know that the person has been working in printing press and manually operating, those composing was done manually, and the black ink was essentially with the lead, plumbum, and that used to cause this liver cirrhosis, and we have seen this being reversed with the remedy.
Wonderful. Thank you so much.